There, my name is Jennifer Boutel, and I'm excited to present a project kickoff on implementing an electronic patient room whiteboard with Epic integration. A little bit about myself is I have experience with inpatient care and participating in projects with electronic health record integration. I look forward to pitching this electronic patient whiteboard to the group. So to kick off this project, I want to start with our current workflow. So currently, nurses are going into patients' rooms and manually updating dry erase whiteboards in the patient room. They do this at the beginning of their shift. The process takes about 10 minutes per room when you consider putting on your isolation gowns and washing hands and interacting with the patients. The nurses manually transcribe information from Epic to the dry erase board and introduce themselves. Some of the challenges with this is they're only updated about once a shift. And if this is missed, the information can look really outdated. Sometimes leaders in their rounding have noted the whiteboard hasn't been updated since the previous day, and this has led to patient complaints. They're not feeling attended to or that they're being communicated with often enough if their patient whiteboard isn't updated. Investing in an electronic whiteboard automatically synchronized with the electronic health record of Epic. So the care team is updated automatically, and there's more room to add information the patients really want to know, like when can I get my pain medication next? Or what's the plan or my goals for the day? So this gives us more impactful information right in front of the patient to really make them feel well informed. So the purpose is really to have these whiteboards be implemented, operationalized, and have that automatic Epic synchronization. And the goals of this are to improve the patient experience, decrease errors related to communication, like those whiteboards not being updated, and improve the nursing workflow efficiency. So nurses aren't spending about an hour a day when you consider a 6-patient assignment updating the whiteboards. The roles of this project, myself as the inpatient director responsible for the area where the whiteboards will be implemented, will be the project manager. Our chief nursing officer will be the sponsor, and she's going to be responsible for getting executive approval to begin the project and the funds. We are going to use one of the med-surg unit. We have several like departments in size and patient population. So we're going to pick one 24-bed med-surg unit to implement this on. And this is going to be great because we really have a baseline and then the implementation unit to cross compare the results. Our team and the execution plan is that this is going to be a collaboration with the vendor and our internal team. So IT and Epic are going to be involved to make sure that this works with our server and we can have accurate, reliable, real-time information going right into every patient room. The vendor offers installation opportunities for these whiteboards, and we're going to have engineering oversee that process for the hardware installation. Nursing is going to take the lead with the clinical workflows, making sure we have strong alignment with patient education and how we really want the clinical staff to engage with these whiteboards. And our core team members, they're going to be educators, managers, quality, and regulatory to make sure that we involve key stakeholders early to maximize project success. I know I started with the why, so I did want to pause here on the executive summary of what we're going to cover in today's proposal. And I did include a picture of what one vendor has to offer for an electronic patient whiteboard, just so you could have something in your mind as we were going over this proposal. You could see that the care team is on the left, and then there's some information such as the plan of care, the mobility and fall risk assessment, the diet, and when the patient can next get their pain med. Also, you can see there's progress and how we're progressing in the education plan. There's lots of ways to customize this that the stakeholders will have to get into, but this is just a general image of what this could look like. We're pitching this at a community hospital in Middletown, Connecticut that exists to provide the safest, highest quality care and best experience possible for our patients and community. This project ties seamlessly with the core values of pursuing excellence, supporting innovation, and delivering compassionate care. So our outcomes, we're expecting to have this epic integrated whiteboard technology to improve the patient experience, staff communication, and operational efficiency. One thing that we've noticed with leader rounding is that the whiteboards are not always up to date, and that has been an area of complaint for patients. There are opportunities for care coordination and patient education questions to improve by leveraging the whiteboard. We took a look at our Press Ganey scores as an inpatient area, and many questions overlap that fall under care coordination, which is essentially communication about the plan of care and patient education. So leveraging the whiteboards as an electronic tool to engage the patient in this discussion is a really helpful solution that we've seen work based on the literature. This also will improve communication. Most of our falls are actually staff assisted falls where the information either was missing or outdated on the whiteboard regarding the fall risk status. So we want to decrease errors related to staff not knowing the information. And we're expecting this to save about 1 hour of nursing time per 12-hour shift. Here's a look at the recent evidence. These are peer-reviewed articles in the last 6 years, and they have demonstrated by implementing virtual whiteboards and standardizing whiteboards, patients feel that there's improved communication and scores related to this metric. They feel safer and they feel more empowered to engage with their healthcare teams. They have a 95% approval rating, and it has been shown to reduce nurse burden versus manually transcribing. I went ahead and pulled some data from the unit we plan to implement this on related to Press Ganey or patient experience scores around care coordination and patient education. As you can see, the top number in red is below benchmark, which is the number in black below. We're not outperforming the benchmark consistently in any of these metrics for this patient care department. As you know, patient experience is one of our core pillars, and it's also data we're tracking from a magnet application standpoint. Additional metrics, as I said on the previous slide, are to decrease errors or events related to communication. I had talked about eliminating errors related to uncertainty about fall risk, which we will use an NDNQI metric, improving RN efficiency to decrease that 16.5% of nurses' time spent updating whiteboards, and we can validate this through time studies. And also we will continue leadership rounding and study if we can eliminate patient complaints about the whiteboards not being updated. Predictive project management methodology will be used for this project. Implementing whiteboards, it's a waterfall approach. It has sequential stages, and there's a logical order. Conversely, while agile projects are more flexible, they might be superior for other projects, but it's not needed in this case because we're operationalizing a solution that already exists and can be purchased from a vendor. We also could consider an incremental approach, but expanding this project beyond one unit is currently out of scope, not included in this project. That's where the predictive project management methodology was selected. I want to clearly define in versus out of scope. We're going to implement the whiteboards on a 24-bed med-surg unit, just one unit. We're going to have epic integration and staff and patient educational tools. Out of scope. This is not going to be a hospital-wide initiative, and we're not going to be replacing patient televisions. You may see in some of the quotes that the whiteboard is essentially a television with internet capability, but we're going to be keeping the regular TVs for entertainment, and this is only replacing the whiteboard. The vendor must have a workflow plan for Epic integration. We're not going to be a beta site. A beta site would be out of scope. And our key deliverables are vendor selection and compatibility with our current server and technology, installation and hardware, staff training and patient educational materials, and a workflow plan, project implementation, and finally, evaluation. I want you to meet your team. We already talked about that the chief nursing officer will be the sponsor, and myself as the inpatient nurse manager will be the director. We're also going to have a med-surg nurse manager where this whiteboards are going to be implemented. Clinical nurse involvement, I want to have at least one day shift and one night shift nurse. A nurse educator, our Epic informatics team, information technology, our vendor, and engineering. Obviously, with all project management, stakeholders have significant duties, whether clinical or project-based. So we're going to have to really commit to a strong project charter that we're all going to see this through. And I'm confident that we have the right people identified to implement these whiteboards. Other departmental contributors will be quality and regulatory, and we'll need to add on super users once we get closer to go live. The external partner is our vendor. So selecting a vendor will be one of the first things the team does. And nursing is going to be focused on workflow, how this engages with our patients, their education, their communication, and the Epic informatics team and vendor will be focusing on the software build, testing, and making sure that this works well within our network. Risks. All projects have risks, and we have a risk mitigation plan for this project. Some of the risks involve IT, quality, financial, and just general project risk. Cybersecurity is always a risk. While we think that this is a low risk, the threat is significant and it can completely stall or stop the project if there's any kind of server compatibility issue. So we are engaging our Epic and our IT team first to validate that products will work with the current servers, and we'll only partner with vendors who have experience doing this before in acute care hospitals. We're not going to be taking the risk of being a beta site. HIPAA compliance, very limited threshold for error here. The correct information must pull to the correct room every single time. We're going to ensure we test this rigorously room by room. And also the patient information displayed is not going to be sensitive. So it's going to be more generic information. Like we're not going to, of course, have a domestic abuse screen on the whiteboard. It's going to be more focused on medication, pain, care team, things like that to minimize the risk if an error were to occur. The financial risk, there's always a financial risk when you're investing in a project that the return on the patient experience scores is not going to be as expected. So we will validate the impact on those scores and all of our metrics before scaling this project. Overall, putting this on one unit significantly limits the financial risk. And then stakeholder risk, as I had mentioned with our team, stakeholders do have demanding roles with competing priorities. So we're going to make sure that we really have the best team and that everyone is committed before we even launch the project. All right, let's get down to business, the business case and expected benefits. So here we have our financial breakdown for the virtual whiteboards. In summary, the anticipated cost is $65,600 for year one. And then for year two and ongoing, there's going to be an $11,520 annual cost. This is based on an ongoing operational cost of about $40 per whiteboard per month. The capital breakdown for the $65,000, most of this is going to be on hardware. we're going to have to purchase these whiteboard or TVs and the mounts, and we're going to have to install them. We need to cover licensure and warranty and installation, as I said. Conversely, we could have our internal engineering team install these. That could potentially save some costs. However, there are a lot of competing projects for our engineering team. So it's the team's recommendation to just have the vendor install and really bear the brunt of that work. The expected benefits are we're going to be able to compare this med-surg unit to other departments to see the clinical outcomes against our standard dry erase boards. And just as an FYI, our current televisions on this department are over 10 years old and end of life. So if this whole thing's a complete flop, then we can convert these whiteboards into TVs, and this could kind of be ahead of a future cost. Again, televisions is out of scope, but it's kind of like a back door should we want to pull the plug on this project. I want to share the project budget. This is a high-level overview of the projected cost of the budgets. You can see this is a repeat of the previous slide, but it's a different visual on how some of the major costs and resources are allocated. We have our hardware and installation. We already listed that the cabling and wiring exists, so there's $0 there. Our software and warranty is broken out. And then we have training. This might be a risk. The external vendor will support training included in the software licensing and subscription budget. However, there will be internal training costs such as super users and obviously the project managers who are completing this project. As I mentioned with the project methodology, a waterfall approach will be used for key milestones. There is a logical order here for implementing electronic whiteboards, leveraging a vendor partnership, and I've highlighted some of the major milestones below. This is going to be a fast timeline, but we want to get these whiteboards executed so we can really see the results of this work. This should be not a high risk execution, as we're going to use a vendor who's already implemented this before at an acute care hospital. The project charter and stakeholder commitment is going to be the initial start of the project, followed by here where we're getting executive approval for the project. Vendor selection is going to be what the team dives into first, as we really want a strong vendor partner. We're going to engage IT early to make sure that this works with our server and that we have a strong design. Epic is also going to be engaged early. We're going to have to do a lot of testing. One of the risks is that we always need the right information to the right room every time. So we're going to be testing this on every single room as we implement it. Hardware and whiteboard mounting and installation is going to take some time. We're going to have a process for moving the patients out of the room while we install this whiteboard, which is going to be a partnership between engineering and the clinical staff. We want to give staff enough time for training. This is not going to require a lot of lift for the staff, but we really want to make sure that they're engaging with the whiteboards the way the project team has envisioned this project and adapt accordingly to the needs of the clinical staff. Then we will begin go live. We're going to be monitoring that very rigorously as this is being implemented, followed by an ongoing evaluation. So in summary, I want to ask the executive team to approve this project charter and invest in the electronic patient whiteboards with Epic integration to promote the patient experience, improve staff communication, and improve nursing operational efficiencies. Implementing these whiteboards is relatively a low-risk intervention that can improve our patient satisfaction and staff communication and workflow efficiencies. Our mission is to provide the safest, highest quality care and best experience possible. So this project supports those values of patient experience and patient safety. It's important to know our competitors are already leveraging whiteboards. There are numerous strong vendors on the market which we can partner with right now. So we have an opportunity to implement this project on one 24-bed inpatient department and then really evaluate it and compare it to similar units for ongoing expense. While there are initial capital costs of the $65,600, the ongoing costs are significantly less, only $11,520 annually with a 5-year warranty. I asked the executive committee to approve this project charter. I wanted to include my references as discussed in the previous slides. Thank you so much for reviewing this presentation. I'm available for any questions. I look forward to discussing more. Thank you.